Thank you so much, Lalit. Okay, so I think we're gonna pick up a little bit on a discussion from the things that Lalit has shared. So I would like to invite everyone who is here to just start filling in, you coming in with your questions, and we hope to address. We have some time, so I hope we can address most of them during this the session of this webinar. So Lalit, thank you so much for that insightful sharing. I think. What I really got from everything that you brought out was this burden that you carry, right? And you have translated that into so many viewpoints and works and things that you are continuously creating. And I really appreciate that the ideas and the knowledge that you have built around the burden that you actually have experienced in your profession. And what I really want to pick on and really bring up in this discussion with Aaron is this idea of the part where you brought on the mentorship, right? This character-based support. And uh, Aaron, what are your thoughts on this? And I know that you have a big stance on mentorship, and you are very interested in that area of work as well. So I'll let you take it from there.
I actually will ask I'll actually ask Lalit later what really Cynthia helped him with. But the truth of the matter, when you were telling the story, again, this is almost like old people talking. But I can almost imagine my mentors in the times where I was having real difficulties, what they would say to me, right? So whether it be Prof Chong Xiao whether it be Prof Thomas Liu, whether it be Prof Ong Tu Chai, you can almost, as much as you hear the child's name, you also hear their voice to a certain extent. So I guess really that mentor mentee type of relationship certainly is something that is worthwhile picking on. The question is, of course, I'm quite sure my mentors were not taught how to be mentors. And truth be told, if you ask me, it's almost like parenting, right? You see one, you do one. How your mentors mentored you, you do it to your juniors. And the question is, as with parenting, you may not be doing it rightly, right? But we see this as something that goes on in terms of the apprenticeship, the relational system in which we train. And so in that aspect, right, I think a worthwhile discussing or contemplating what in this mentor-mentee relationship is helpful and in what areas it may be helpful. Meaning moral distress, vicarious trauma, are we talking about burnout? Or would burnout just help with more people on the ground? That type of questions may be worthwhile, especially if we are talking about senior or management taking a stance on it. Senior doctors like us that are not senior management, but certainly are in charge of our well-being of our juniors. And then really on the ground, what the juniors may need to take responsibility for as well. Back to you, Lalit or Amin, if you want to comment.
Yeah, just building that, Lalit, like, now Aaron has asked you a question, so I'm gonna load that question with another question. I think I think the question on everyone who's attending today is it's wonderful because we all stand on the shoulders of our giants, right?
Mm.
And that's it's an important saying for academics such as us. And so tell us more about the Cynthia Go mentorship program. Naming the mentorship program after your mentor, it's a very powerful
Mm.
emotion, a very powerful experience. So tell us that a bit more about that. And yeah.
So, okay, um, a lot of it's based on research, and a lot of it is based on lived experiences with a wonderful mentor. Um, so let me answer first Aaron's question, which was what Cynthia did. Let me give you an example. A mentor relationship pivots on the quality of the interaction between two people. There must be trust. And there must be the ability to know that I can ask for help without being judged. I'll give you an example. When I first started, in Singapore, it was just me, Prof 𝐶𝐸𝐾, and Dr. 𝐤𝐤𝐤𝐿𝐤𝐤. And 𝐤𝐤𝐤𝐤 stepped out because it took some time out after her pregnancy. And it was just me, and I had this really, really difficult patient. I really didn't know what to do. And I called Cynthia, and she was in Argentina, and she answered the phone and gave me advice. When I think when my children were born, both of them were not well. Both of them ended up in special care. I never said anything. Cynthia was there. When I got married, Cynthia was there. So was 𝐤𝐤𝐤𝐤, to be honest. And for when my dad died, and that was one of the hardest times in my life, she was there. When I struggled with cases, she was there. Just as when she was there when I got my first PhD, my master's, my second PhD, she was always there to support me. That is the meaning of it. And I think the thing about it is that we used to go out for lunch once a month. No matter what, we'll go out for lunch and we'll just talk. The last time I met her, she prepared me for her own death. That was hard. The thing about it is that it's that relationship, it's that rich relationship that you need. And so a lot of my work on mentoring has been looking at enriching that mentoring process. So you're right, Aaron, the main thing is you need mentors who are trained. You need mentors who know how to support people. And you need mentors who are invested. I think that's the key to success. But you also need mentees who are invested. They see the value, they're willing to give as much as they receive. And the moral to the whole thing is everything we do, at least in NCC, palliative care team, is paid forward. And of course, we look after our own. We look, and that's really important. You never feel alone. And that's what a mentor actually does. I can list you a couple of papers that we did on mentoring relationships, but I won't do that because this isn't a lecture on a cure for insomnia. But yes.
Thank you, Lalit. Thank you so much, and I wish I can meet Professor 𝐶𝐸𝐾 𝐿𝐤𝐤, and this sounds like it's not just a working relationship. It's a relationship. It's a bond. Where we're talking about something that transcends beyond professional lines and professional identity, but really having that person in your life, and at the same time growing with that person. Not just, it's not a shake hand and I'm going on to the next chapter. So, you know, thanks, Lalit. And I think that kind of resonates with the first question we have from the audience. Thank you so much, Prabha, for this question, because on the topic of mentorship, it's also important to talk about the culture that we are born into and we are currently working in. Singapore is a culture um, they ask you to be resilient, and if you ask for help, psychological help, you're looked down upon and being unable to cope. And how do we change this mentality? And this really resonates with you calling, Professor Cynthia and saying, "Hey, I'm having trouble with this." How would you take this, Aaron or Lalit? You can chip in either.
I'll just answer a bit, but certainly, but the challenge is that I'm answering from a very psychological point of view. So again, views from beyond may be valuable. It is true in as much as there is a stigma to the term of needing psychological help. And I don't think it's just a Singapore culture issue. It's this whole issue of not wanting to appear weak and then having issues in terms of whether you are being either externally stigmatized or internally stigmatized. Having said that, in my mind, that's where the role of the senior, that's the role of where the mentor, that's where the role of the peer is quite important. I mean, in making it not stigmatized, as Lalit has clearly said, this is not something that we can run away from. And to then double whammy the person by saying, not only am I subjecting you to this, but then on top of that, I'm saying you're weak. That may help in terms of the senior seeing it in this particular way, right? Of course, you can say changing culture takes time. The seniors, and I suspect a lot of people in the room, we are preaching to the converted, right? But again, it is if you believe in the tipping point, we need a good number of 1/3 of people to believe in this, and then things will start moving, right? So again, as seniors, what are you going to do about it? And as the people that are stigmatized, and you know that you need help, what are you going to do about it? So that's the question, right? I mean, on one hand, we say senior management, but then what do we do as seniors, stroke mentors? And then what is the responsibility for the person on the ground to seek help? I hand it back to you, Amin.
Thank you so much, Aaron. So, yes, at the end of the day, it's really about the person on the ground um, and how the person on the ground feels, and it's really about them at the same time really determining that level of mentorship and what they want from the mentorship as well. We can have good mentors, and like as great as Cynthia Go, and at the same time, we can also have mentees who are not ready to receive that amount of care. I'm not sure, I think this kind of builds very nicely into Paul's question, talking about the things that you mentioned earlier, Lalit, on cynicism, right? So Paul says, great sharing, Lalit, and hello, Aaron. A paper in the Lancet discusses cynicism as perhaps having a strategic virtue, being a shriveled form of hope. Do you feel that this cynicism can be harnessed for benefit here in the SG context? Talking about how we can really work the idea of mentorship and how can we place it in this thing that you're observing in the residents or medical doctors. Lalit, for you?
Yeah. Thanks. Paul, thank you for that. Easy question. So we did a study on the cost of caring amongst Malaysian geriatricians, palliative care physicians, and A&E doctors. And what we found is that cynicism is present. That cynicism is actually largely self-preservation. I can only take so much pain. I can only relate to you so much. But the problem is that I'm cynical now. If I don't deal with that, I'll become more cynical and more cynical, and I'll become less empathetic. I'll give you an example. I was talking to a colleague of mine, and I remember telling her, it's been a bit of a tough time, and I remember what she said was, "I can't empathize with you," and I thought, interesting, but it just kills everything. But you see, the thing about it is that you also have to understand that part of it is that self-protection. What you don't know is what she's been through and why she has to do that. We are very quick to judge others, but there's a wise person once said, when people judge you, you ask two questions. Well, you state two things. One is, they don't know me and I don't know them. And in this case, I do know her and I do know why she said that. So cynicism is useful, but but not in the way you think. I look at it as a wonderful warning sign. When someone becomes cynical, it's the time that I need to go in and see why. Because I do the most wonderful job. I look after people in their most vulnerable. I look after people who have come to me and said, everyone else seems to have given up on me. I look after a human being. And the key thing about it all is that I look after them the same way I would expect my loved ones to be looked after. I can't afford to be cynical, and I can't afford my staff to be cynical, because then they don't get the care. And if my staff is cynical and don't give the care that they need, then it's my fault, right? Because I didn't look after them. So cynicism is a wonderful thing from my perspective, because it warns me that someone is struggling. Thank you.
Thank you, Lalit. Wonderful. That's wonderful sharing.
I'll jump in.
Yeah.
I'll jump in if it's good. I fully agree. Yeah. I mean, the
Yeah.
studies have shown that curbing your empathy actually helps you deal with the situation. But it is in the situation where you are already being overwhelmed. It's survival mode now. I mean, the work that we do in our caring profession is very noble, but it's not easy. It sounds funny from a psychiatrist, but I remember as a medical officer watching the poor person exsanguinate in front of you. I never wish for anyone to see such a thing. It's tough. It's really tough, right? So again, I mean, to be fair, it is tough work, and the lack of empathy to distance yourself, so to speak, ends up being protective. But it's certainly a telltale sign if this is the only strategy that you have to protect yourself. So I like what Lalit had written in his paper. There's a level of discomfort as a warning sign. But when it starts being distressed and it starts being fatigue, maybe you have gone to instead of the skepticism where I hold judgment, if you move on to the cynicism and worse still, nihilism, we are going to be in big trouble. So the discomfort is really a good metaphor for red flags coming on. And truth be told, there is such things as post-traumatic growth, but it's that we need to actually be able to intervene at the appropriate time. Back to you, Lalit and Amin.
Thank you so much, Aaron. That's really the why we can actually build this conversation. But before we do that, I would like to let everyone know who's here today. The questions function is still open, so please keep your questions coming in, and we'll be happy to answer them. So while you're thinking of your question, we will continue with this discussion. So that is the whole crux of the matter. So Lalit, you brought up this idea of risk factors and actually identifying issues that come up. And Aaron, you're saying that that's where you need to pause and you need to assess the situation, because you know that this person may be headed to more maladaptive experiences that can cause a lot of pain and a lot of suffering, right? So in that sense, when you see risk factors, which means there's suffering happening, there's pain happening, right? And we talk about when I introduced this talk earlier, we talked about this idea of the spirit, the human spirit, and you actually start to see these wounds that start forming in individuals. This idea of wounds. So, Aaron, this is for you. So, from a psychiatrist point of view, and also the specialization in human well-being, maybe you can start the discussion on how we can start to address these wounds. What is out there? What can we do? So we talked about mentorship. Is mentorship enough? What more do we need in the current situation?
I'll address it from the mental health point of view. Truth be told, I guess, to be fair, mental health is one extreme where it's a diagnosable problem. But a lot of support does not need to be labeled as mental health issues. So that's the first thing. Little things can be through support, through mentorship, so on and so forth. be useful in terms of supporting the person for the, lack of a better term, post-traumatic type of growth, right? And the warning signs is when, I guess, to a certain extent, discomfort, and in spite of the interventions, leads to further physical as well as emotional symptoms. That was when you will be a bit more concerned and a bit more in terms of seeking professional type of help. Refocusing on the healthcare professional and almost a threat to the existential sort of identity that the person has. I guess to a certain extent, from an education point of view, from a professional development point of view, there is a role for us to actually help in terms of this developing and building what we are talking about in terms of professional identity. And as it morphs, as it changes, as more things happen, the ability to build or to shape what the identity is can and may help with how we experience stress, trauma, scars, and so on and so forth. Back to you.
Yeah, Lalit, what are your thoughts on this?
So let me just share a little figure. Let me get this right. Can you see my screen? Yeah. So basically, when we look at how people are coping, we actually need to think about the whole thing. It's not just internal. It's not just about my strengths, my emotional resilience. It's about my values, my biases, where I am, social structure, how much support do I have? For me, it's my professional support comes from some of my colleagues who I've, like, for example, Dr. Yi, I will call her most days in the week and we'll just talk about work and just decompress. Most days I would inflict my ideas and plans and for world domination on my wife, who has now developed selective hearing loss. Then but that's not enough. It goes back to the team that you work in. For example, there are teams in which being able to say, I'm sorry, I'm having a crap day, I just need a few minutes, would be viewed upon as being unprofessional or not good enough. Whereas there are teams in which they say, look, you don't look so great today, let's talk about it. And I like to think that that's where we're headed. We also have societies that also have become a little bit more open to the fact that there's a lot going on in everybody's lives and people need different types of support, but also a nurturing environment to work in and grow. Because as we grow, we provide better care. So yeah, so that's what I've got to say. I'll leave that back to you.
Thanks, Lalit. So that really, is that, the critical matter that we are discussing here today is that, that nurturing environment, that the idea that you can go back to your team, and really decompress and hold, um, you know, we in our social networks and the people that we meet, sometimes we kind of feel that, it's a rare commodity, that this is not something that is thoroughly available to everybody. And Aaron, there's a question I think you can take, Aaron, in the comments, Badria talked about, understanding, that you will be more, if you know and understand more about life and people, you will be more cynical. And true people are very rare in this world. If you have one, treasure it and defend it with your life. Um, so yeah, maybe you can talk to that, maybe in the context of like nurturing environments and building teams, like what Lalit mentioned.
I think the biggest challenge we have in healthcare is we cannot afford to make a mistake. Or at least that is the mindset, right? We cannot afford to make a mistake. So what we are going through is talking about perfectionism or perfectionistic tendencies. but we realize that we're all humans and we'll make errors. So if we take that as an overall stance, if you're going for perfectionism, everyone must be their true self, and the true self is only the good self. We are setting ourselves for, unfortunately, cynicism. And then if you then see there are enough people that you think makes N equals, or rather confidence interval, 95% confident, and then you say, yeah, no point, and then you end up being nihilistic. So the challenge I have is, although we are working in a very perfectionistic type of world, which causes a lot of this unnecessary tension, I think what we should be thinking about is excellence and not perfection. Right. So what do we talk about in terms of excellence? At least this is our expectations for the fallible human. In my mind, when you say excellence, as speaking about my daughter getting first in Oxford, we are talking about 75 or 70% and above is excellent. Right? Of course, it doesn't stop you from reaching for the stars, hitting 75, 80, 90, good for you. But excellence is to be the best that you can be given what the situation is. And so I would give some people slack, right? If you're 50% of the time good, and then you're 50%, if you're 51% of the time good, and you're 49% of the time not so good, still pass, still pass. But if you're 75% of the time good, and then less of the time when under tremendous stress, as Lalit said, you may not know what's going on the other side of the person's world. Maybe we shouldn't expect the person to be perfect all the time. So it is almost this dissonance, right? At what we expect 100%, but yet it is unrealistic. We are as seniors, we are generating unnecessary burnout. That is my sense of at least to comment on this idea that seeing more of the world ends up making you a bit more cynical. In fact, I see the more of the world and the more you see of good people, you may actually become and end up being less cynical. And that's what we're hoping to develop through this sharing. Back to you.
Yeah, thank you so much, Aaron. So Lalit, that is building right on that, right? And jumping right. I think this is like the last question that we can have for this session is how do we lay that groundwork, for seniors, leaders, right? For leading these teams, to have this to develop this greater psychological safety for the people in their teams.
Okay, that's a very good question. It's work in progress, but I can tell you where the work has come up to. I'm going to share with you another picture. Hope it works. Is that working? Yeah, I assume so. Okay, so basically what we know about how people deal with situations is, if you look at it, this is from a study on how death and dying affects surgeons. A surgeon's experience comes from, the circumstances of the patient's death, the nature in which the nature of the surgeon's relationship with the family and the patient. It is the experiences, the wisdom, the lived experience of the surgeon itself. It is their psycho-emotional state and resilience. It is who the person is. So if it's someone who's naturally calm and collected, then it's easier rather than someone who's hot-blooded and easily angry and with poor EQ. But I think that's really, really important is the support mechanism that a person has. The study that we did, and we looked at surgeons specifically, was because the data was actually quite poor in terms of the support mechanisms that are available. That's changing, thankfully. I think with residency programs, certainly we've made a conscious effort to improve support. But I think being aware of these factors will help us build a better, more supportive, more nurturing environment for the generation to come.
Thank you so much, Lalit. Aaron?
I'm sensitive to the time.
Mm. Okay.
And so I think what I will do is just share, I'll close and share, and then maybe, you can do the necessary housekeeping.
Mm.
Would that be okay?
Yeah, that'll be okay.
So I just shared my screen, a bit of airtime for me, 2-3 minutes. But first of all, I would really like to thank Lalit for gracing this occasion. To be fair, Abraham Lincoln once said, a leader must make whatever horror concrete, and only then will people be able to break it apart. And I would therefore like to, again, I repeat that the work, the insights of this often neglected topic, and it's the advocacy to make these horrors actually known, the cost of carrying horrors known, concrete, will help us try to break through it. And so this is really, as our discussions were in before we even came on, really Hume is hoping really to align with some of these missions and then wanting to see how we can help with this matter. So a bit of letting us know about it. If you've attended the SHBC last October, the education track, you read the latest cover of the LifeWise magazine, but more importantly, this commentary by Michelle Zhong in Annals of Singapore Academy of Medicine, you would have an idea that Hume, or humanistic medicine, is one part of NHG Group Clinical Education's larger initiative to develop the art and heart of medicine as we pursue the advances in science, technology, AI in healthcare. And as mentioned, Hume is just started in January this year, so we are just finding our feet. So when Michelle actually coined this term, I thought it was a clever play of words, albeit misspelled. But more importantly, it showed that the strategic intent of the NHG education. It is because we are concerned for the future of healthcare professionals and need a roadmap or at least a general guide on how we can help our healthcare professionals of the future. I quote her here. While AI may provide some level of assistance, doctors will need critical thinking skills in applying technological solutions in empathic and ethical ways. And this has to be integrated with this socially constructed knowledge of the patient's illness experience in the gestalt of medical expertise. And this is in the context of working in teams and working with our fellow healthcare workers. So in that is where, to a large extent, we are hoping to engage and help in terms of Hume. Now, Hume is organized into really 4 main foundations, of which we are looking into these areas, really biomedical and medical legal literacy. And the aim is to equip healthcare workers with the on-the-ground applied knowledge to enable them to practice at the top of their game and not just defensively. For Foundation Do, we are looking at actually healthcare beyond the biomedical, well-being and flourishing. And this takes into account not just the patient, but we are talking about the healthcare individual as well as himself, his team, as well as the organization. Only when we are able to experience well-being and flourishing can we actually do well in what we do. With these 2 foundations, we are actually looking at this as good basis for Foundation 3 and 4, which looks at healthy aging, how we apply Foundation 1 and 2 to healthy aging, living with chronic illnesses, and equipping the professionals with the language to coordinate care better. And finally, of course, as the population and the individual progresses to palliative care, to actually how to coordinate it better and even look at specialized forms of palliative care. I'll leave with this slide. The real voyage of discovery consists not in seeking new landscapes, but in having new eyes. And this type of talks help us actually have new lenses in seeing relatively recursive type of problems that we see in healthcare. With that, I'll hand it back to Amin to do the necessary. Thanks, Amin.
Welcome, Aaron. Thank you so much, Aaron. Thank you so much, Lalit, for, well, basically for really giving us this brand new eyes, this fresh lens for us to look into something that we've been hearing about it, we've read about it, we are noticing the pain, and not just we are giving we identify this whole idea of suffering, right? This idea of suffering that no, Lalit, you so beautifully brought it out to demonstrate to us how this is in so many, it permeates through so many levels of in the healthcare. You're seeing your nurses, you're seeing your doctors, and you are seeing that these all of this is something that um really needs to be addressed, and especially there needs to be an understanding of the socio-cultural sensitivity that really looks at what is suffering to us in this current scenario, in this current context of the Singapore healthcare system. And one of the things that we really talked about today was the idea of mentorship, and not just mentorship like each part of residency, and then you have a mentor, but a mentor that is a person, that bond that you have with you in your life, that person who carries you and really bees and stays with you, and it is something that never ends. But Lalit, you also beautifully brought up the fact that mentorship probably is not enough, and Aaron, you also demonstrated that when you look at it from a psychiatric well-being, mental capacity assessment kind of a point of view, that a lot more really needs to be done. And the lens needs to be shaped to look at well being, to look at spiritual interventions, to really look at the wounds that people have, look at the risk factors, for example, cynicism, and address this in teams, in leadership, and really look at this from a top up, top down, and bottom up levels of work that is currently heavily required in the areas of emotional, psychological coping, and also spiritual interventions. So, I really hope this is a wonderful talk today. I hope that I have summarized it correctly. Thank you both so much for your thought-provoking insights. So for everyone here, thank you so much for attending our webinar today. For those of you who are interested to read about Lalit's work, you can use Google Scholar, or you can actually reach out to our office at Education Research. Reach out to me, and I'm happy to share his articles. But make sure you have a Google Drive for it, because there's already a lot of Lalit's work to get through. So some housekeeping matters. I think in a while, our colleagues will be flashing a QR code for the for your feedback, and also you can register your interest for future events that we have talked that Edu Research will be organizing. So thank you so much, and we really hope to see you in the next webinar. Thank you.